So it's really important to regularly see a dentist because it allows us to identify problems when they're small. It allows us not to let things get worse and to develop. It also helps us to support and educate you to make sure that you're looking after your teeth as well as possible at home. So we do lots of checks when we have you in for your examination. It's not just checking over your teeth, we'll also make an assessment of your gums, we'll check the soft tissues, so we'll check the rest of your mouth, we'll do an oral cancer screening, we're checking how your teeth bite together. There's a huge amount that goes into an examination. So we get lots of patients that are quite nervous about coming to the dentist, and the great thing about prevention is it means that we have to do less dentistry for our patients. So the more you can work on getting things right at home, the less we've got to pick up things like the drills and the handpieces. So historically, a lot of patients used to go to see their dentist every 6 months. However, we've realised that just that blanket approach isn't applied for everyone. So your dentist will be able to give you some guidance in terms of how often they want to see you. For patients that we want to keep a closer eye on, we might see them every 3 or 4 months. For patients who've got and developing less problems with the teeth, we might see them once a year. Absolutely, we can help nervous patients, and it's really common. We get lots of patients that come into the practice and they're a little bit apprehensive, a little bit nervous. We're here to help, and we're here to explain what we're going to do for you, and we work alongside you to find a treatment plan that's going to work for you. So it's really important to bring children to see the dentist because lots happens as your teeth are growing and as your teeth are developing. It's really important that we're checking those teeth over. We're making sure they come into the right position, and more importantly, we're making sure that we're developing good preventive habits from a really young age. So we want to make sure that kids are eating and drinking the right things, that they're brushing their teeth correctly. And again, it allows us to spot things when they're very, very small. Particularly trying to manage children at a young age, it's difficult to do dentistry, it's difficult to do treatment for them. So the more we can prevent things from developing, the better. Yeah, absolutely, we can help, yeah. One of the big things that we do as dentists is to help to get patients out of pain. We understand it can be quite distressing, toothache's not nice, and we're here to help. So the first thing that'll happen at emergency appointments is I'll want to have a really detailed history of your pain. I want to understand how your pain started, how severe the pain is it keeping you awake at night, are you having to take painkillers? It's really important that we understand these things so that we can help to identify what the issue is. That's going to be followed then with a really thorough clinical examination so that we can assess your teeth, try and find out where the pain's coming from. And often we'll take things like x-rays that'll help to support us finding the right treatment for your tooth. And ideally then we can create a diagnosis and we can get you out of pain. So the best way to prevent toothache is to come and see a dentist regularly. Often toothache happens because people haven't seen a dentist for a while and small problems become much bigger problems. The great thing about coming to see a dentist regularly is we can spot problems when they're small, we can stop them getting worse, and we can prevent you getting toothache.